I smoked pot at 10 years old.
Joshua Dudley was raised in church, but narcotics took over his life for 2 decades in Columbus.
Just started using opiates and pain pills and eventually heroin, you know, and it just got worse and worse, and I was in a dark place.
We've had explosions in the heroin overdose rate.
Up 300% in the last 3 years in northern Kentucky, according to that area's drug control policy director.
And it really cuts across all demographics. And I think that that's really been a big part of the awareness, because it's really gotten out of that urban core and into the suburbs.
We've lost a generation to prescription drug abuse in southeastern Kentucky.
It hit personally for Nancy Hale, who leads Operation Unite, an organization tackling illegal drug use. Her son got hooked on drugs, but survived. And they got involved in their community, learning quickly that the plague of addictions where they live was similar in Atlanta, New York, and everywhere.
Because let me tell you, what happens in Georgia affects us in Kentucky.
We have an epidemic in Georgia. We lose over 700 folks a year to prescription drug abuse.
States with the highest rate of people showing up to licensed drug treatment programs where their primary drug is a prescription opioid.
The dark-colored states, including Alabama, had the most problems back in 2001. Then Georgia was included a few years later, then the entire U.S. covered.
The top 5 drugs in our state for overdoses are Oxy, Xanax, Hydro, Methadone, and methamphetamine.
Georgia Attorney General Sam Olens tells us putting someone in prison does nothing to stop the addiction. So for the last 5 years, Georgia has focused on criminal justice reform, adding accountability courts with alternative sentencing for nonviolent offenders.
We don't need to be paying for them in a county prison or the state prison. We need to get them help. The treatment center is key, and keep in mind a lot of the folks that start with opioids then go to heroin.
Treatment did work for Michelle Atencio, who used drugs for nearly 3 decades in the Columbus area. She says many people just don't know there's help out there.
You know, the first thing everybody thinks of, I don't have the money to pay for that. There are places out there that will take you in and help you get into recovery and, you know, get a better life without paying a dime.
In this area right now, we have several. Valley Rescue's free. There's a waiting list, but usually they'll put you to work at the mission.
Here in downtown Atlanta, one of the main themes of this National Prescription Drug Abuse and Heroin Summit is that it's not just about bad people doing bad things. In fact, the U.S. Surgeon General is here, and he said that addiction is not a moral failing, but a chronic illness.
I know as a professional pharmacist that this is a disease. It is a weakness.
Speaking at that drug summit, U.S. Representative Buddy Carter of Savannah told the crowd doctors need to follow rules, but it needs to be a team effort.
It's got to be the federal government, it's got to be the state governments, it's got to be pharmacists, it's got to be physicians, it's got to be nurses, it's got to be family members.
When we're doing community-based work, that really makes a difference throughout our state.
His job is leading behavioral health prevention in Georgia. Travis Fretwell is preaching education in cities and neighborhoods.
I think certainly it's about citizens as well as state officials. I think it's an opportunity for us to take these initiatives and begin to push and advocate for proper drug disposal.
Along with taking out those pills and dealers, there needs to be genuine drug and alcohol education programs for younger children. That's the advice of former drug dealer Neil Richardson, now executive director of Safe House Ministries in Columbus. He's had success with faith-based 12-step programs.
There's got to be a spiritual component. If this is a war, and we're not strong enough to win it by ourselves.
That people are really set free from the bondage of addiction through this testimony.
Behind bars for a second time, Joshua says he gave his life back to the Lord and has been clean for 2 years now, not even craving drugs anymore.
I just prayed, and he took all the temptation away from me. You know, I was selling drugs, like destroying lives, and now I'm given hope.
He now hosts Bible studies and ministers to homeless in the valley through the nonprofit Take the City, telling others how he overcame the heroin habit.
Jesus will take that away from you. You know what I mean? There's one step, it's Jesus. There ain't 12 steps.
And one vital step for state leaders is to catch people like Joshua before they get stuck in the drug world.
Our goal ultimately is to prevent things from happening, but in the event that they do, we want to be able to provide the appropriate treatment.
Leaders in Kentucky and Georgia say they're meeting with physicians, judges, jailers, advocates, and police to determine really how to help these addicts.
And needed to understand what the counties could do in terms of increasing treatment, increasing naloxone.
You need to work with the doctors so that they fine-tune which patients really need opioids and which don't.
With 40 Americans dying every day from overdosing on prescription painkillers, President Obama has proposed $1.1 billion in new funding to help those addicted. In my fifth and final Ending the Epidemic report, the president's plan.